Good morning. On behalf of my team, composed by Professor PhD Luminita Moraru, lecturer PhD Simona Moldovanu, and PhD attendant Cristinel-Gabriel Rusu from Dunărea de Jos University of Galați, I propose you classification of cardiovascular diseases using ECG signal and genetic algorithm. So, in the introduction, we know all that ECG provides an early screening of cardiovascular diseases to diagnose patients with cardiac diseases and resulting in disability or activity limitation, which are important factors for reducing the quality of life. Genetic algorithms related to ECG signal processing are useful for feature extraction, feature selection, hyperparameter tuning, model selection, arrhythmia classification, CVDs diagnosis, optimization of monitoring and alarm system, cross-validation, and generalization. My research objectives are to give the ability to genetic algorithm to optimize the classification prediction for the detection of cardiovascular diseases based on ECG signal. The second objective is that the CVD diagnosis is accomplished based on different feature of ECG signal. In the background, electrocardiogram signals are of huge significance in diagnosis cardiac diseases all over the world because they are a cheap way to diagnose those diseases and due to their ability to provide essential information about electrical activity of the heart, detection of arrhythmias, ischemia and myocardial infarction, monitoring cardiac medication. There are several trials in medication test and they use ECG for monitoring these trials in assessment of hypertrophy and enlargement, risk assessment, pre-operative evaluation, long-term monitoring, evaluation of pacemaker function, research and clinical trials. The P waves occurs during a trial depolarization. The QRS complex, which consists of QR and S waves part, occurs with ventricular depolarization. The T waves is generating during the repolarization period of the ventricles preparing the heart for the next heartbeat. Genetic algorithm optimization helps in selecting those values of the parameters of feature inputted so that percentage of error rate classification is minimalized. In the literature, I'm not the only one who studied ECG signals. As you can see, they use support vector machine for detection and classifying heartbeat rates. Also hybrid classification method based on Bayesian and extreme learning machine technology for arrhythmia detection, deep learning framework that integrates various networks to efficiently diagnose arrhythmia diseases, low dimensional ECG beat for feature vector, 12 feature, for automatically arrhythmia beat classification, also support vector machine for cardiac arrhythmia prediction, discrete wavelet transform method for denoising and classifying them using support vector machine. So denoising, when we input ECG signal, we have other waves, artifacts, we name them. And with the use of discrete wavelet transform, we can clear the input, so we have only what's important. So ECG classification strategy using the extreme learning machine and genetic algorithm, wavelet kernel extreme learning machine, were used also. and an algorithm based on a genetic algorithm combined with a back propagation neural network along with a wavelet packet decomposition for feature extraction is proposed for classifying ECG signal. My team research is started from open access database Kaggle. We extracted feature as shown in above table, such as QRST waves, some area like QRS and QRST waves, and some pathological wave JJ waves. Genetic algorithm optimization helps in selecting those value of parameters for feature inputted so that percentage error rate for classification is minimalized. We use 7 machine learning classifiers: random forest, decision tree, ADA boost, quadratic discriminant analysis, Gaussian naive Bayes, K nearest neighbor, and gradient boosting. So we started from recorded ECG on paper, scanned. We have initial feature like Q waves, R waves, S wave, T, P waves, area below QRS waves, and QRST area. The block diagram for proposed method for ECG signal classification is that. So this feature we inputted, and by genetic algorithm we obtained new feature for classification. We applied the 7 model for classification, and we measure metrics: accuracy, recall, precision, and F1 score. How about genetic algorithms? They are borrowed from biology. They provide solution space throughout the iterative process of selection, crossover, and mutation for better solution over successive generation. Genetic algorithms efficiently explore complex solution space of feature QRST waves and 2 areas, QRS and QRST. They provide a systematic and automatic way to enhance the performance of classifier, ultimately leading to better predictive accuracy and generalization to unseen data. Fitness function aligns with the specific goals of classifier optimization task. So why genetic algorithm? Because we have a lot of data, and we need to select those features significant for diagnosis cardiovascular diseases. What are results? We improved performance statistics when selected features were optimized using genetic algorithm. As you see in the picture on the right, the fitness function convergence in terms of generation for the selected classifier for decision tree, quadratic discriminant, and Gaussian naive Bayes and K nearest neighbor classifier. The convergence is obtained, but the dispersion of this value denotes the instability of the solution. Random forest classifier achieved superior performance over the classifier, as the characteristic error computed for each generation converges to the least value. The same data of ECG signals for both experimental conditions were used. The genetic algorithm can reduce the number of features used, improving the performance of the original algorithm. In the case of decision tree algorithm, a massive features reduction has been provided by genetic algorithm with the cost of the performance of classification. Random forest algorithm performs consistently before and after optimization. It has the best performance in both experimental cases. Classification using decision tree, quadratic discriminant analyzer, and Gaussian naive Bayes perform poor compared to the other methods. As we can see, for proposed method, we obtain an accuracy of 91.1%, which is, I can say, is great. In conclusion, a method based on genetic algorithm machine learning classifier was developed to classify ECG signals based on optimal feature selection. When the genetic algorithm worked with classifiers for ECG classification, an optimization of the inputted feature was achieved. Comparison with initial classification results that were provided by classifiers solely revealed that the proposed method is more efficient. Genetic algorithm is a valuable tool for simplifying the classification task by reducing the number of inputted features and improving the algorithm performance. As a future study direction, the proposed method will be tested on other ECG database because there are a lack of data in ECG scanned images all over the world. This work was supported by Project Dynamic, financed by Romanian Ministry. Now I present the references, and if you have any question, will be more than pleased to answer. Thank you for your audience.